Hi, this is Dr. J. Just wanted to go over a lid care protocol routine that I recommend my patients, especially if you suffer from dry eyes or lid problems like burning, stinging, itchy, or recurrent styes. So there's 4 steps to this process. So first is you want to warm up your eyelids, specifically your glands, meibomian glands. Then you want to massage them to open up those pores, and then you want to wipe them clean. And the last step is to apply a spray called hypochlorous to disinfect the lids and the lashes. So first is to warm the your eyelids. So the key is you need consistent heat for at least minimum 5 minutes. So we recommend a microwavable mask or an electric one, whichever one you prefer. So inserting this in a microwave for about 15 to 20 seconds, and then you want to just test it, make sure it's not too hot, and then you place it on your eyes for minimum 5 minutes, and then once it's hot, right after, you want to take the tip of your finger, make sure they're clean, and just massage them right on at the edge of the lid margins. So not right down there, but more right on the edge. So the bottom and the upper lid. So a few times, both eyes, and then and that will help the oils to flow out from those pores. And then after, you want to use one of these wipes. So this is a tea tree oil based, and this is non-tea tree oil. So you just take one wipe, and you all right, and then you either you can go open, or you can close it and make it into half, and then close your eyes, and then wipe it from the outside with your eyes closed just a few times, and then lift your lid up, look down, and then wipe the eyelash line, and then look up, and then again wipe the lash line, and then do the same thing for the other eye. You may want to turn this upside down again, and then close your eyes, wipe a few times, and then look down, lift your lid, and then you may want to do this way, and then look up and wipe the bottom lid. So you may want to do this in front of a mirror, and it takes a little bit of time for practice before you get really good at it. And then if you're using a tea tree oil wipe, good idea to just let it sit for the tea tree oil to get in there and try to get rid of those mites. And then after, just wash it off with water, rinse it, and then lastly, at the end, before going to bed, or before the routine, you want to use the spray. It's a hypochlorous spray, which is an antiseptic for bacteria. So just with either 1 or 2 sprays with your eyes closed, and just let it sit there. Do not need to wipe. So the key is the routine needs to be consistent, not just one off. And if you do this daily, I guarantee this will make a difference. Again, it doesn't have to be every day. Initially, you can do every day, but as you get better, as things get better, you can reduce it. Even 2-3 times a week. But the key is consistency. Thank you.